I'm Dr. Peter Leung. I'm one of the obstetrician gynecologists working in the Science Hospital. I'm also the consultant as well as the clinical director in IVF Australia as well as the Fertility Centre Liverpool. So obviously the common questions we also get to ask all the time is actually how long did the fertility treatment last, and how many times do I need to go through it? Now the short answer to that is actually very difficult to judge, right? It really depending on the original causes of infertility, as well as pretty much the age of the lady. Now we know that on the average, the chance of successful IVF treatment, if you're less than 35 years of age, that's about 50% to 60% per cycle. So the odds are pretty good that you'll be able to achieve a pregnancy fairly quickly within the first few goals of IVF treatment. Once you reach about the age of 35, unfortunately, the chance of success was dropped very rapidly. So the chance of success then per cycle is usually dropped to about 10 to 15% once you reach about the age of about 40, and it reaches only between 3 to 5% if you're over the age of 43 to 44. So you can see that the numbers of cycles that patients potentially have to go through in order to achieve a pregnancy if you're in a much older age group will be significantly higher. So that's why we always emphasize to the couple, if they get the choices, think about early family planning instead of delaying having kids. Don't leave it to the last priority in your checklist, as this is actually sometimes getting harder and harder rather than easier. So overall, most of the patients will be able to achieve their goals, hopefully within the first 3 cycles to 6 cycles. We do notice the chance of pregnancy is fairly static or stable within the first 3 rounds of IVF. However, once you reach about that number, if you're going to the 4th, the 5th, and the 6th cycle, you do have some chance of pregnancy on using IVF technology, but we do see a diminishing returns. So by doing further IVF treatment cycle, you would then having a lower chance of pregnancy, simply because that the more successful one, or the one that's been treatable with IVF, would be already falling pregnant on the first few goals, and the remaining patients still have difficulty, may have issues that is not correctable by the IVF technology. So as a result, more patients going through multiple rounds of IVF tends to have a lower chance of pregnancy because of that. Now we do have had solutions for some of these patients. In particular, if we found that the problem is actually related to the quality of the eggs and sperms we had. In Australia, it's actually okay to have donor eggs and donor sperm treatment, so it's definitely doable in Australia settings. Although obviously the couple would still need to find their potential egg donors, as currently egg donation is in short supply, so it's not like a very easy thing to do, unlike in other countries where there would be a more abundant supply. Because in Australia, the egg donation treatment is done through altruistic reason. That means that all the basically egg donors coming through is really wanting to help out people, pretty much like you want to go to Red Cross to do blood donations. You only get a piece of biscuits and nothing else, right? Okay? So from that perspective, it is harder to ask other people to come in to help you, because the IVF process actually is usually lasts for like 2 to 3 weeks, where the potential egg donors need to come through, apart from seeing the doctors as well as nurses to learn how to go through the process. Commonly, they would need to have injecting a medication to their system in order to stimulate the ovaries, and they also need to have a surgical egg collection. That means that they need to have a general anesthesia, as well as a minor operation to retrieve the eggs from the ovary. So as you can imagine, it's actually quite a long process, as well as quite involved. And so it's not quite easy to find an egg donor unless you are familiar with the egg donor. That means that you either know them personally, as either your friends or relative, or sometimes people are lucky to find somebody able to help them through social media platform or in some of the egg donation website, where there are volunteer organizations helping to connect the potential egg donors with the potential recipients. So from that perspective, all the patients obviously still have a chance of achieving the pregnancy through that means. But as overall, we still encourage the couple, if they have having problems with infertility, don't put it off to see the doctors. Try to work up the problems as soon as possible, and then try to basically institute an effective treatment as early as convenient as you can.